Well, good afternoon or good morning, depending on where you're joining us from today. And we want to welcome you to our ISU Extension and Outreach Dairy Team Heifer Raising Your Dairy Best Heifer webinar series. We have been doing this for a couple of weeks now and excited to have our next topic here this week talking about heifer health. And so if you've joined us the last couple times, we've been focused on raising our dairy best heifers with a few different topics here. And today we're going to be starting to talk about heifer health. You can see on the slide, we do still have some upcoming webinars coming up still in July 30th. We're going to be coming back talking about heifer reproduction. And then we'll finish out the webinar series in August, talking about heifer benchmarking. We'll also invite a heifer grower panel onto our discussion and then finish up with economics of raising dairy heifers. So today I'd like to welcome Dr. Phil Jardon to our webinar series. He's going to be talking about heifer health. Dr. Jardon graduated from the Iowa State College of Veterinary Medicine. He completed his master's in dairy production medicine residency at UC Davis, and he's been in private practice and industry for the last 35 years and has particular interest in young calf management and transition cows diseases. I know him and I have worked quite a bit extensively in the last year on young calf management as we talk about colostrum management and other important management practices revolving around the young calf. He also has interest in transition cows, and that's been a passion he's been working on since working on his family's dairy and working on milk fever on his parents' dairy as part of his 7th grade science project. So long-standing passion for the dairy industry. In the last 11 years, he was a dairy consultant with Elanco Animal Health, and we're happy to have him for the last year with us as a dairy extension veterinarian at Iowa State University. So thanks for joining us, Dr. Jardon, and we look forward to your discussion on heifer health today. So I'm going to go ahead and stop sharing my screen and
all right,
you can go ahead.
So before we get started, I just want to talk about my team a little bit here. This is the dairy extension team at Iowa State. Fred Hall's up in the northwest corner. He's on the call today. Then Jen, our host, is in the very northeast corner. Larry kind of covers the rest of the eastern part of the state. And then Gail Carpenter, who's on the call today, and myself and Jan Shearer are here in Ames. So that's our team. I really excited to join this team about a year ago. I like the fact that we not only spread about across the state geographically, but also in interest in topics and things. We make a pretty strong group. So today we're going to talk about bovine respiratory disease. The title is Heifer Health, and Jen told me she kind of wanted to have it be mostly about respiratory disease, so that's what we're going to cover today. So we kind of use the term bovine respiratory disease and pneumonia kind of interchangeably. The term bovine respiratory disease kind of means our whole concept of shipping fever, and when animals get stressed, they tend to get infections in their lungs. So they're kind of the same thing. We kind of got a specific thing with bovine that we call bovine respiratory disease. So here in the picture, the one to the left, you can see this light colored part of the lung. That is actually normal lung. And then this part that's really dark, you might say it kind of looks like liver. That's terribly affected lung, and it's really consolidated. That calf's pretty sick probably from that much. And as you get more and more worse cases, more of the lung will be affected and less of it will be normal. And then the calf has a hard time getting enough oxygen to live. So I'll go back to that one there. So to orient you, son, this mass right underneath here is the heart, and into the front here to our right is the calf's trachea, and then so that's the cranial part of the calf toward its head, and then this back part here is toward the back end of the calf. So this part here is right up against the diaphragm, and when the calf gets pneumonia, we tend to think of it as being a cranioventral presentation. Almost anytime we post a calf and it has pneumonia, this is the first lobe that's affected. These lobes up here to the front. And it's called cranioventral because it's to the front and to the bottom. And if we look at this bull here, we can kind of see where that would be, because it's because of anatomy. The first place that air hits when it gets to the lungs is that cranial part, and then gravity helps pull it down to the ventral part, which means the bottom part toward the bottom of the animal. All right, we are going to talk here a little bit about the disease triangle, and I just find this very useful to think about almost any disease, whether we're talking mastitis or any kind of infection. We can look at this disease triangle. So on the top here, we have the host, which in our case here is the calf. And then bottom here, left here, we have the environment. And then we have the agent. So those are the specific viruses and bacteria that are going to be causing the problem. And we kind of need all three of these things for there to be a problem with pneumonia. And they all interact together. So when you think about that, we have the host and the environment interacting. So that's in the how they spend their time, with the air they're breathing, where they're laying down, that kind of thing. The host interacts with the agent. So that's with, if the calf has antibodies to it, it's got been vaccinated, it interacts that way. And then the environment and the agent interact with each other. And that's where we kind of get to our biosecurity thing. So I really like that this, I got this from a article from England, and it says it's just little things that make such a big difference. And I think that's the case in a lot of things we work on dairies, but I think particularly with this one, it's a lot of little things that have to go right and little things that can go wrong to cause a problem. So today I've kind of picked out these topics to talk about with talking about pneumonia. So we're going to talk about vaccines, mostly around the handling part of it. We're going to briefly mention colostrum, and colostrum is so important that it really shouldn't be mentioned briefly. So we're going to talk about that with some other sources of information that you can go to. We've actually had we have one coming up and on colostrum, and then we have one we just did recently. Okay, nutrition, and specifically we want to talk about the nutrition at weaning, and then housing and ventilation, and then some thoughts about consistent diagnosis of bovine respiratory disease. So I'm going to talk mostly about handling, but I'm going to first go through here and talk about the viruses and bacteria that cause these things. So these are the things that we have in vaccines, and the reason they're in vaccines is because they've been shown consistently through the years to be a problem with causing respiratory disease. So here to the left, we have our viruses. There's IBR, which is infectious bovine rhinotracheitis. A lot of you might know that from its common name, which is red nose, because when calves get it, they get a red nose, as you might think. BVD is bovine viral diarrhea, which is kind of a misnomer. I mean, it does cause diarrhea, and that's one of the ways it was discovered when it causes this bad diarrhea. But it's immunosuppressive, kind of like AIDS is in humans, and that's probably its biggest problem. Then there's PI3, which is parainfluenza 3, which probably isn't all that bad to animals, but it does kind of set them up for secondary infections. And then there's bovine respiratory syncytial virus. So those are the 4 viruses that we tend to always vaccinate to prevent pneumonia in calves. Now the top 2 are also used to vaccinate for because of repro problems. They can both cause abortion. Okay, so what we believe happens is that calves get set up for these infections with these viruses, and then these secondary invaders come in. So a lot of these bacteria that we have over here, I have these listed, Mannheimia, which Those of us that are old and learning at school, that was called Pasteurella hemolytica, but now it's been changed to Mannheimia. You notice in some of the vaccine names, it's still called Pasteurella. You might see it called as PH. It's Pasteurella, meaning Pasteurella hemolytica. Then there's Pasteurella motacida, which stayed Pasteurella. And then there's Histophilus somni. So those are the bacteria that are sometimes in vaccines. They kind of have a mixed reputation of whether it really are effective or not, but some people have had success using those. Then we have two different types. There's modified live, especially for the viruses, and killed. And there's theories about which one of those is better. And you work with your veterinarian on that, and then follow the rules too on those. Sometimes you can't use a modified live. Sometimes you can't use a vaccine at all if an animal is going to be used for export or for a bull stud or something. And there's two different ways it's given, as an injection or intranasal. So I'm not going to get into a lot of this today, all the pros and the cons of all these different ways, but work with your veterinarian to come up with a system that works with your farm and with the disease pressure that you actually see on your place. But I do want to spend some time here on vaccine storage. So these are tips that came from the CDC. So this is intended for human storage, for storage of human vaccines. But I think we can learn a lot from them, and maybe not do everything exactly like they say, but I think understanding why they recommend some of the things they do helps us maybe make a better way of storing and using our vaccines. So starting with the position, it says position 2 to 3 inches from the walls, ceiling, floor, and door. So the door, of course, is close to the edge and might get a little bit warmer. And you get up close to the edges where the air flows, it's more likely to freeze or more likely to be in the wind shadow. So it's better for the vaccines to be clearly in the middle of the refrigerator. If similar packaging or names are used, put them on different shelves. Sometimes these bottles look a lot alike, and so it's really a good idea to keep them as separate as you can so there's not confusion over which one the workers are supposed to be using. Okay, avoid storing other items in the vaccine refrigerator. Now, I think I've been to probably thousands of dairies in my life, and very few follow this rule, but I think it's would behoove us to maybe pay a little more attention to that. Usually you find workers' lunch in there, and I'm going to show you a slide here in a second of some colostrum I think should not be in there. All right, allow airflow in the refrigerator. So look in the refrigerator and see where the fan is, where the thermostat is, and where the air comes in, and don't have things in the way to keep air from moving. Because sometimes what'll happen is where the refrigerator picks up the temperature and says it's cold, it'll be a little bit warm there. And then it keeps running and running. So it's going to get that part of the refrigerator cold. But in the meantime, it freezes the stuff that's right in front of the fan. So that happens to us sometimes in my family's refrigerator, especially right after my wife goes to Costco and comes back with a big container of cottage cheese and a big container of sour cream. And if we put those in the wrong spot, they'll end up frozen instead of just refrigerated. Of course, watch the expiration dates. Vaccines are biologicals. They're proteins from the viruses and the bacteria, and they do in time decay, and they're not as good as they were at the fresh. So it's not something to take the expiration dates on vaccines pretty seriously. Okay, then monitor the temperature. I'm sometimes surprised by how often I go to a farm and feel a bottle, and the bottle feels warm. I mean, not even, you can just tell that the refrigerator's not working, or it's not in the right spot. So these pictures here to the right, this is actually from a calf ranch here in Iowa. They got this monitor right here, which this cable goes into the refrigerator and up right here to this little bottle of water. So the CDC suggests that the probe should be in a little bit of volume of water to keep it from fluctuating when you open and close the door all the time, because it's really the vaccine itself that we're interested in. And so that helps us keep from overcorrecting and overanalyzing the data and the temperature. This particular calf ranch also has this thermometer out in the front here in case this other one goes bad. So the one reason they do this on this particular calf ranch is because they had an experience where they had an outbreak of respiratory disease, and they believe that it was really because the vaccine had gotten warm and spoiled on them, and it was no longer effective against the diseases. So now they do a really good job of making sure that the refrigerator is always working and the vaccine is always cool. Each vaccine is a little bit different on what they suggest, but it's usually somewhere in the order of 35 to 36 degrees Fahrenheit or 36 to 46, somewhere in that range. The third, and freezing is a real problem for vaccines. It can alter the vaccine and make it more reactive, which might cause more reactions. And so it's really important not to freeze it and not to let it get too warm. The manufacturers and distribution take a great effort to make sure it gets to the farm in good shape. And so I think it's something we should do on farms, just to make sure that it stays good after that.
And Dr. Jardon, I do have that poll question if you wanted to put that in here right now.
So what do I have to do? Anything, or you just comes up?
I think I'll launch it from here, and
Okay.
You should be able to see it, right?
Yes.
All right. So we're asking the question, how do you monitor temperature when you're storing your vaccine? So if people could go ahead and click on your choice, whether you aren't monitoring at all, or maybe you feel the bottles to see if they're cold, like Dr. Jardon mentioned, or you have a thermometer in the refrigerator for monitoring temperature of the vaccine. So we'll give you a few more minutes or a few more seconds to select those, and maybe some may not be able to click on that. I see there's only one person that's answered so far.
Hopefully more than one's paying attention.
Right. But they did get it right. I'll share the results. So they did say they do have a thermometer in the fridge. So that's good for the person that's answered that. Okay. Go ahead, Phil.
Okay. So do I press the button that says share results, or do you do that?
It should be cleared. Oh, let's see.
Just close the.
Yeah, we just closed it. There you go.
Dialog box. Yep.
Yeah, very good, very good. So my experience with that is sometimes in a lot of the thermometers that monitor different things on farms, I'm going to ask how they do it, and they show me the things, and I find out that the battery's broken in it or something. So it's important to monitor that. So this particular one here, this is actually from our Jen and I did a colostrum management talk, and we showed this to show how slowly this vaccine, these bottles of colostrum get cold. But you think about it, so every day this dairy would harvest these 8 or 9 or 10 bottles of colostrum, which is 4 or 5 gallons, 3 to 5 gallons, and then right above it are all these vaccines. So that they were getting warm twice a day. So this is one reason we don't want other things being stored here, especially things that are really warm and need to get cold in the refrigerator, which I'm against for colostrum, by the way. I got something held up there. Okay, so now we're going to talk about colostrum. Just got a few slides on it. The one reason we're very concerned about colostrum, it's just that we've known for a long time that calves get off to a better start with colostrum. This slide here that I got from Jen actually talks about all the reasons that we think that it's better even beyond that very young calf, that after a cow gets to be an adult, she gives more milk, She's less likely to get pneumonia when she gets weaned. She gets bred faster. There's just all sorts of reasons that we want to get the colostrum into the calf and make sure that the colostrum management is working well. So this is actually a slide I got from Sandra Godden, or some data from Sandra Godden, and it shows that calves with high levels of antibodies that came from the colostrum were less likely to get sick than those that had low levels. And it's pretty dramatic. Those that get colostrum really do a lot better. So we talked about the 5 Qs, and in the presentation that there's a link to on the bottom there, Jen and I go through these in more detail, but you want to make sure the calf gets enough quality. So that means greater than 50 grams per liter. But the more the better. The more antibodies in the colostrum, the better it is for the calf. You want to make sure the calf gets about 10% of its weight in colostrum, and it needs to happen pretty fast. The ability of a calf to absorb colostrum goes down pretty quickly. And then what I'm very passionate about is it needs to be really clean. Colostrum spoils really quickly, so we need to treat the colostrum like we treat the milk we're selling for humans. It needs to go from cow and get cold very quickly. And then there's good tests we can do for bleeding a calf to monitor whether the calf got its colostrum or not. And then the last one I added down there is the temperature at feeding. So you can, I don't want to say this is not an important topic. It's a very important topic, and it's so important. There's a whole nother webinar on it, and you can get that down to the link. And then Fred Hall is puts together these I-29 MU universities with 4 other states. You can see them there: North Dakota, South Dakota, Nebraska, Iowa, and Minnesota. And we have one coming up here with Sandra Godden. She's going to go through advances in colostrum management. And she's one of my colostrum management heroes. She's done a lot of very good work in that area. Has a lot of good suggestions on how to improve a dairy's colostrum management practically. Okay, now we're going to talk about nutrition, and specifically nutrition at weaning. I think this is one reason I picked this as a topic, because I think it's something we don't have a good understanding on, and it's something that some dairies miss out on. So I want to go through this a little bit of how a rumen develops and why that's kind of related to our pneumonia. I mean, you kind of think of, that's a GI thing, not a respiratory thing, but they are closely related. So this is how a rumen develops. When a calf is born, the abomasum is the biggest part of the 4 chambers of the stomach. It's 60%. And the rumen's only 25%, and their reticulum's only 5%. And as the calf gets older, it becomes a 3 to 4 months old, right here after we weaned it, it's 65% rumen. So the rumen get a lot bigger. And when it gets to be adult, it gets to be 80%. So it's really important before we wean the calf to have the rumen fairly well developed. This newborn calf, up until about 3 weeks, it really doesn't digest very much other than milk. I mean, it might eat a little bit of grain, and that it helps to get it used to it, but really it's not going to get much good out of anything except for milk that first 3 weeks. And then what we feed them makes a difference. So this is always kind of amazed me how this works. So this picture on the left here, this is from a Penn State website or a document. This is the calf on the left only had milk, and notice how smooth that is. The papillae aren't very well grown. It didn't get those long projections out in there to get the absorption. The middle one is milk and hay, and notice it didn't really grow that much. It grew maybe a little bit more, but to really get good growth, the calf needed to be eating some grain. So the one that is seated, the one to the right there, is calf eating milk and grain together. And we think that's because the butyric acid that's formed gets absorbed through the epithelium, and that helps stimulate the growth of those directly. The people ask here, well, how does a beef calf get its rumen developed? And that's because the beef calf tends to have more time to get the rumen developed, and the sugars in grass that's growing quickly are pretty high. So we probably do get more of that growth on the C, but mostly it's because of time, and those calves do have a little bit of grain-like stuff in eating that lush grass that comes. So this is just a graph showing how the rumen gets pretty big for over the first few months. So now talk about these accelerated programs. I think they're great, and it's the way we should feed calves. And actually, I don't like the term accelerated. I think we should use the term kind of normal. And whereas before, when we fed calves 2 quarts of 2020, we were kind of starving them to death, and they couldn't grow very well. They couldn't fight off their diarrhea very well. And we've done a much better job of getting calves up to that 2 months of age. But one problem is when the calf gets up to that 2 months of age, if they've been getting lots of milk, they've not had very much grain yet. And so even when we start backing them off, that when a calf gets to eat 2 pounds of grain, which a lot of people use as the amount that calves should get, that they haven't had enough time to develop that rumen. So the rumen looks more like this one to the left or the right instead of these two to the left, the middle one and the left one instead of this one to the right. So we need to make sure the calf gets this one to the right. So we can do that a couple different ways. We could delay weaning, but sometimes delay weaning it's the most expensive part to feed of the feeding spot, and then it also might just delay the issue. So I've become a big fan, especially on these accelerated programs where we fed a lot of milk during most of the milk phase of the calves, is to have this step down weaning over several weeks so that we can get that rumen to develop properly with those papillae developing right. And that also may help decrease the tendency of calves to suck on each other. All right, I want to talk just a second here about coccidiosis. In my time in industry, I spent a lot of time with coccidiosis, and then also investigating these problems both as a veterinarian and a nutritionist. So you see down here to and I find that once people understand the coccidiosis life cycle, it kind of helps everybody prevent the problem. So a calf will eat these things called oocyst, and they're called the sporulating oocyst because they're developing inside this little thing. And O just means egg. And then there's 8 little sporozoites that are going to come out of each of those eggs. So a calf eats this, and then almost right away, the sporozoite comes out and infects the cells. And then it's got this kind of long, complicated life cycle. It goes through these things called schizonts, and then we get these merozoites, and then those merozoites get into the cell again, and then we get another schizont, and then more merozoites, and then those become these are all asexual phases. They're just dividing, and then we get to the sexual phase where we get these macrogametes and the microgametes, which are kind of like the eggs and sperm, not quite, but sort of like that. And here's the stage where actually the calf gets very sick. But what a lot of people don't understand is that when a calf gets coccidiosis, they're thinking the calf, a few days earlier was stressed, or maybe a week earlier. But the truth is, we've been setting the calf up for this failure for 3 weeks. So it's really important for these calves to have good intakes. And if you're feeding something to help fight the coccidiosis with ionophores or some of the other chemicals, calf needs to be ingested in for it to work. And it has to happen this whole 21 days before the calf or the calf might break with coccidiosis. So here are some of the things I think can contribute to that. A lot of times when calves go away to a calf ranch, and sometimes on a dairy, they'll have a cable, and no restrictions on where this calf can eat. And then it comes back to the home dairy, or maybe just a different pen on the dairy that the calf was on. And the calf has to learn to stick its head through the gate, through these lockups. And sometimes that just doesn't happen very well. So I think it's really important to not make these transitions for these calves hard. Make sure they're used to whatever they're going to be getting in the next point in their life. Okay, the same thing can happen with these feed changes. So you can imagine if the calf was used to eating this stuff over here that kind of looks like you could put milk on it and eat it as a cereal yourself, and into something that's got, it's really rough and has a lot of forage in it. These transitions have to be made fairly slowly so the calf can get used to it. But this is one of the things that'll lead to a coccidiosis problem, and I'd say a pneumonia problem too. I think coccidiosis can lead to pneumonia, pneumonia can lead to coccidiosis, and the same things can lead to both of them. I think it's really important to have these transitions done really smoothly. So another thing is to have the calf so they can find this feed. When a calf you put a calf from a hutch into a bigger pen, and it has to go around and find out where its feed is. That's not always easy for that calf. So having access, like an extra little bunk out in the middle of the pen or something like that can be very helpful. Okay, I'm just going to talk a little bit about ventilation. But again, this is such a big topic. There's we had webinars on these topics just by themselves on ventilation. So I want to give a shout out here to the people in Wisconsin. Our colleagues there have done a really good job of putting together very good information on barn design, flow rates of air, and that kind of thing. And you can find it here at this website. It's a very, very inclusive website with lots of good information. All right, so here's where I chose to put in this saying. It's one of my favorite sayings. It says, "More is missed by not looking than by not knowing." I first learned this from Joe Sexton, who I was riding with as a vet student, and he meant it both as a wake-up call to always be looking for things, but also that you don't always have to know everything. Sometimes just look around and make sure you're being observant, and you can solve a lot of problems that way. The original quote came from Tom McRae, who was a Canadian physician. His brother wrote the Flanders Field, where we get our idea to have poppies at Memorial Day. Okay, so another one is go to the Gemba, which means go to the place where the actual work is done. I learned this from Paul Rapnicki in a troubleshooting course. And that means to go and actually look where the calves are, where the cows are, whatever you're looking up. And I want to make a point here in this particular one, thinking to this calf facility here to the right. If we walk down this alley on a farm, sometimes you think, oh, the air in here is great. But you really need to get your head down and smell and look where the calf actually lives. Because sometimes the things will seem really fine out here, nice and clean, but inside it may not be as clean as you think. And you'll get ammonia smell or a musty smell, and you'll see that the calf is not as dry as you might think. So when I say go to the Gemba, go to the place the work is done, actually go to the place where the calf is living also. So just a point here on bedding. Bedding needs to be really dry. This was done at by Alfonso Lago, and he looked at the different things that cause calves to get pneumonia, and said one of the things is calves that get cold because they get chilled. So having good bedding and having the calf be dry is really important. So part of this comes down to the design of the building to make sure that the water gets away from where the calves are living. That's water's a really bad thing. Their moisture's a bad thing for calves. All right, so on ventilation here, talk just a little about this natural ventilation. These open ridges will help the air move through. And you want to design the building so that it's good in the winter and in the summer. The air moves through a little bit different. You want plenty of slope on the roof so that the air actually goes out. When you think about a flat roof, you know, it's going to keep the heat in. You want to be able to open up the sidewalls so that we can take advantage of the natural breezes in the summer and close them in the winter, and still have the air be ventilated out, but keep the calf warm. We want to be free from wind shadow, so we don't want the calf building right next to a dairy barn or something that's going to block the wind. And then an east-west orientation helps protect us some from the sun and helps take a bit better advantage of the wind in the summer from where the wind usually comes from. All right, and in the supplemental ventilation, these can be very handy and actually very necessary in some barns, especially some converted barns. It's hard to get the air to come in naturally, so we can force it in and actually get fresh air to be pushed down around the calves. It's quite a science to this, and the website here at the University of Wisconsin's Dairyland Initiative has some plans on that. I think getting some professional help to figure out where to put those holes, how many holes, and how big the holes should be. That's not the easiest math all the time, and I think getting some help in figuring out where to put those is a good idea. But they can be very effective in helping get air down to where we need it. And you can put those in both open housing, like here in the right, or in the hutches like on the left there. So here's a link to a couple different webinars that we've done with specifically about the ventilation, so you can take a look at that. All right, and just a point here on diagnosis. I've sometimes been surprised on some farms how different people have different views of what a calf with pneumonia is. Some will look at any calf that has just a little bit of anything wrong with it and think it has pneumonia and treat it. Other people wait till the calf's almost dead. So I think it's good to have some training on when a calf is actually sick and when it's not. So this is a webinar series that we had done here a couple months ago. This is Terry Olivet from the University of Wisconsin, and she's done a lot of work with this ultrasound idea and finding calves that you might have missed other ways by doing ultrasound on them and looking at their lung scores there. So you can look at that and get an idea of how to use that with your veterinarian. And then two different schools have come up with rating systems. And I think whether you're going to do this officially or kind of unofficially, I think it's good to use this as a training tool with your workers to kind of say, these are the things to look at to see if a calf is actually sick or not. So this is the one from UC Davis. Up there at the top, you see there's eye discharge, and a 0 is none. And then as it gets a 2 is when we get more than that. And then a nasal discharge, eardrops, and then whether the calf has a cough, how fast they're breathing, and whether they have a fever or not. They all those things go together to help determine whether the calf has pneumonia. And they have an app with that you can use, or they just have a recording sheet. So they're both can be effective and helpful to figure out if a calf is really sick and to help you have some consistency in your management on the farm. So the one from the University of Wisconsin is quite similar, looking at a lot of the same things. And they also added looking at the stool. But they're both very nice tools, and they both have apps for an iPad or an iPhone to record them on. All right, so closing here, I want to. This is from a paper by Dr. Amaral Phillips at the University of Kentucky, but it's been in other places too. These are the 5 C's of raising calves. So colostrum, of course, we talked about that. Calories, having enough calories, and I'd say add enough protein for these calves can really make a difference. and that's one reason I like the accelerated program, but I don't like the term accelerated. Feeding young calves more fat and more protein helps eliminate a lot of those diseases we used to get with those baby calves with scours, especially like cryptosporidiosis is just not very likely to cause a calf problem if it has enough protein and calories. Cleanliness, I think especially cleanliness on the very young calves, the ones that are 1 day for sure. And that first couple of weeks, it's really important to be clean. And Jen goes through quite a bit of that within that other presentation and how to determine that. Of course, comfort. These animals need to be able to lay down and be comfortable and rest. And inconsistency in almost everything that we do on farms, especially I think with consistency of mixing milk and that kind of thing can be really eye-opening when you start getting that dialed in and have it the exact same every time, how much better the calves will do. All right, so that's the end of the presentation. Are there any questions in the chat?
I haven't seen any come in the chat yet, but I know my colleagues, Dr. Gail Carpenter and Fred Hall are both on kind of monitoring the chat. And so we'll take any questions through there if you want to start typing those in. As you're typing those in, also take a look at the evaluation link that I posted in there. That just gives us feedback on today's webinar. So before you log off today, please go ahead and link or click on that link to provide us some good feedback on the webinar. Gail or Fred, have you seen any comments or questions?
Nothing coming through on the chat yet, but I did have a question for Dr. Jardon. And it's one you probably won't like, but I'm going to ask it anyway. It's a big old it depends question. But one of the things that we talk about sometimes is what vaccines are needed on farms. And I think people tend to kind of fall on a spectrum where all the vaccines are needed and none of the vaccines are needed. And so can you just kind of talk us through, I know every farm is going to be different and every farm is going to have different needs. What kind of thought process do you go through when you're deciding what vaccines fit in a calf's health plan?
Okay. Well, so I think there's two I consider kind of no-brainers to do, and it's more on the repro side than the pneumonia side. That's IBR and BVD. I think it's almost malpractice to not vaccinate for those two. And then PI3 and BRSV come with them. So those four are kind of natural to vaccinate for. And the bacterial ones, there's a big difference of opinion between veterinarians and vaccine manufacturers of whether they're helpful. They've got a kind of a long history of maybe not being as good as we like them to be, but there's continual improvement, and I think we need to keep our eyes on those as they come out. I'd work very closely with your veterinarian on those things. See what works on your farm and what maybe you can leave out. I think there are some things. I think maybe sometimes we vaccinate too much for animals. We either give these vaccines for these things we really think we need maybe too often. And that can be hard on a calf too, right? So we need to be careful of not overdoing it, but yet get them the protection they need. And you're right, Gail. I didn't really like that question. I didn't really want to answer it.
Well, you did a great job.
I'm going to take you back to the feeding idea. What probiotics are out there that we should be utilizing for these young calves, maybe even before we wean them?
Yeah, the probiotics is a tough one too. There's lots of different ones out there that, and I think different people have different experiences with them. I think I just before using one, I'd use look at the literature, see if they have good research backing up their use, and then go from there.
One other thing, when you were talking about dry calves, years ago, I worked for a short time in Wisconsin, and Dr. Wolfel said, "You're going to learn the knee test." And I went to that calf pen, dropped to my knees, and when I stood up, I had wet knees. And he made that point. Okay, the calves are wet, so do something about it. So
That
I'm
that's
sure.
that's a good one. There's two different knee tests. There's that one, and then there's the one that a cow should be able to drop to her knees when she's in a freestall barn without
Yep.
if a human can't drop to their knees, a cow shouldn't be able to drop to her knees either, or be expected to and be comfortable.
And cows weigh a lot more than we do, so
Yes, they do.
whatever we feel, they probably feel a lot more.
So Dr. Jardon, you covered a lot on vaccine handling or storage, and we're dealing with some pretty warm temperatures this summer. How do you handle working with vaccines, as we're working heifers, working cows? Is there any effects to the vaccine when we're actually administering the vaccine?
Yes, there is. Yep. So it's you should have a cooler with ice packs in it, and I think monitoring the temperature in there is also a very good thing to do. Don't mix up more than you need to. Don't mix up all, especially the modified live vaccines where you have a liquidy part and then a little cake part. Don't mix those up way in advance. Mix up the amount you're going to use, and use that within an hour or so, and then mix up another bottle. If you're going to work, if you're going to get 500 doses of vaccine, don't mix all 500 up and then go out and give it all, because it's the longer it's mixed up, the more likely it is to not be very good. And one of my real pet peeves on that is when I see a bottle in the refrigerator where people vaccinated, mix up a 10-dose bottle of a modified live vaccine, and they had 5 animals to vaccinate on Monday. They put it in the refrigerator and do 5 more on Tuesday. That just doesn't work. Those vaccines are not designed to be stable and alive after that much time. And another thing, I'd be very careful on freezing, because that'll disrupt some of the proteins and maybe make them more reactive, especially things like lepto or gram-negative vaccines.
You mentioned a little bit going to the calf ranch, going to the home farm, and we know that some calves get drug all over creation, right? Beef on dairy calves, sold when they're wet, or dairy beef gets sold as wet calves a lot of time, and may go to the sale barn or may get drugged for pretty long distances. Not drugged, trailered, yeah. And same thing, you send your heifers off to a heifer grower and come back. We actually have a project going on right now where we're looking at some transportation stress in calves, and we're throwing them in a trailer and driving them all over the place. Do you have any advice for mitigating some of that transportation stress? It's not always avoidable, right? So what should producers keep in mind when they are transporting calves around?
Yeah, that's a good question. So sometimes you go quite a ways. I think planning the trip so you're not making it when it's bitterly cold or very hot. In the summertime, that might mean doing it at night. In the wintertime, I mean moving them during the daytime. Making sure the calves don't have a draft, because it can get quite cold going down the road in those trailers in the middle of the winter. If the calves are going very far, and I don't know exactly where to say that, but certainly if they're going to be more than 12-hour ride or something, I would give them some electrolytes or some kind of or feed them on the way down on their trip. And I think that's all I have for that right now.
Again, I'd like to remind, oh, go ahead, Phil.
Well, Gail, since you're doing research on it, do you have anything to suggest?
Well, we're in the middle of it right now, so stay tuned. But one of the things that, to add to your list, that's all really good advice, but one of the things that we found pretty early on is some good shavings keep them pretty clean. Especially in the summertime, you don't want to bed them very thick or anything like that, right? Because you want to make sure that they're not getting too warm. But put down some good shavings, and the cat we trailered them for 16 hours, and they came out just about as clean as they went in. So shavings are a good
Okay.
investment. Yep.
We've got a couple of folks from warmer climates listening to us today. And of course, we've experienced some very hot, very humid temperatures. Let's kind of go over what we need to do in the calf hutch to help mitigate some of that. And I'll throw that to my esteemed colleagues. They can tackle that. I mean, obviously, if we can crack the back up, throw a 6x6 block underneath it and increase that circulation, that's the first thing I tell folks. Anything else?
Yeah, I think you're right, Fred. Just finding ways that we can add more ventilation into those hutches. Like you said, lifting them up so that they get some air underneath coming into them. I know there's been some research, I believe, I don't know if Brad is still on, Brad Hines, but University of Minnesota did some research at looking at putting some ventilation kind of individually into pens, trying to get more airflow into those as well. Phil, do you have any other suggestions?
Well, I know that in California, which is a different environment, right? A lot hotter. It's drier, and the sun was more consistent. Shades above the hutches seem to make a difference, but you need to be careful to get the shade high enough to where it's really shade and not an oven that's keeping the air from moving around. I'll bring up another point though about the heat and vaccination though. And animals that are under heat stress are just more likely to have a negative reaction to a vaccine. So if you're going through a hot spell, you might consider delaying vaccinating until it gets cooler, and definitely don't vaccinate in the middle of the hot part of a day.
We have a question that came up about how often to change needles when vaccinating. Do you have any insights on that?
Well, yeah, I think if our industry tends to think, like 5 or 10 is acceptable. On the human side, though, that's not acceptable, right? It's one use and done. And certainly dairies that are trying to control the spread of bovine leukemia virus, it's every shot by itself. That seems like a lot of work and a lot of expense, but when you get the system down, it's not as bad as you might think. But if you're not going to do that, I think every 5 maybe, and then also use some common sense, right? If it gets dirty or it gets dropped or it has a burr on it, then don't use that one.
And personally, I feel like calf needles wear out a little faster than cow needles. They're at smaller gauge. And having cheated a couple times in the past on not changing needles, I feel like they kind of wear out a little bit faster. You can kind of feel a little bit more resistance faster than you do with the.
Yep, I don't doubt that that's right.
Yeah.
So we have a couple of resources in the chat box here. Gail, you had put in the link to certified consultants for positive pressure tubes. That's through the University of Wisconsin Dairyland Initiative. So if you're looking for assistance in implementing a positive pressure tube, there's a link to people that have been trained in that area. I know there's colleagues on our call here that have been trained through that. I've gone through that program. I think Gail or Fred both have as well. So helping producers, understand how to implement one of those. We can visit with our ag engineers as well on that. I also did put in there our previous webinars with this Raising Your Dairy Best Heifer. And so if you missed the previous webinars and you want to go back and review them, they're listed here in our Calf and Heifer website link, as well as our evaluation link. So before you log off again, please click on that and take our survey there. So Dr. Jardon, I want to thank you for being on our call here today. It was great for the resources and the information that you provided. A great overview of calf and heifer health as we go into the summer and fall season. There's a lot of upper respiratory issues that can happen as the seasons change. And I think this is a good reminder of some of those practices we can implement on the farm. So thanks again.
Thank you.
And Fred, maybe before we head off, you can put in if you have it handy, the link for the upcoming I-29 webinar. Or maybe we don't have it handy and I shouldn't have said anything.
Yeah, we've got coming up on Thursday, we have a biosecurity webinar, and it is on our website. So I would direct people to our website and just click on it. They'll get the information and then the link to register.
And after Thursday next month, we have the colostrum management webinar as well. Is that right?
That's correct. And it'll be up on our website probably later on this week. And then we have a second webinar on the 21st with the new manager from Hay and Forage magazine, and she will talk about what's out there in the alfalfa, what she's seeing in this year's crop.
Lots of webinars to partake in. And of course, our Raising Your Dairy Best Heifer webinar series will continue next week. So we're not actually meeting on Monday. We're going to meet on Tuesday, July 30th. We're going to have Dr. Victor Gomez from Kansas State University, a state extension specialist there, talking about heifer reproduction. So thanks for joining us today, and we'll see you next week.